So regional anesthesia, it's basically the ability to block the sensation of pain by simply anesthetizing or numbing up just certain parts or certain regions of the body. So to put it in perspective, regional anesthesia, it'll just put a certain part of your body to sleep, whereas general anesthesia, it puts you to sleep. So we can use regional anesthesia independently, or we can actually use it in combination with general anesthesia. So our patients love it, our nurses in the recovery room love it, as anesthesiologists we love it. It simply just makes us more effective and versatile in certain types of surgery. We have a sophisticated and a specialized nervous system in our body, and there's a gazillion nerve endings. And these tiny nerve endings, when they get stimulated, they carry a certain signal to our brain. And so when you touch something, it carries the touch signal to your brain. And if you touch something that's hot or cold, it'll carry the temperature signal to our brain. And so when these nerves are disrupted or microscopically cut, like they are in surgery, these nerves send pain signals from those nerves all the way up to our brain. And it's then in our brain that these signals begin to become interpreted and processed as pain. So the question is, can we block these pain signals before the signal gets to our brain? And so this is the idea behind regional anesthesia and nerve blocks is, can we help intercept that pain signal and keep it from getting to our brain in the first place? And if we're able to successfully do that, what we essentially do is help significantly reduce or even eliminate the total pain that's associated with surgery. Some of the examples that you probably have heard of in terms of regional anesthetics are spinals and epidurals. We usually use those for labor, but we're also able to use regional anesthetics that can numb up your entire arm, or parts of your arm, or your entire leg and parts of your leg as well. So it's pretty versatile, pretty fascinating. So nerve block is a procedure that anesthesiologists perform where we place local anesthetic, numbing medicine like lidocaine, the same thing that dentists give you in your gums to work on your teeth, and we deposit this numbing medicine around nerves or a bundle of nerves. And basically three things happen. We decrease the sensation to the area that we block, we decrease the movement to the area that we block, and what we're most interested in is that we decrease or eliminate pain signals from the area that we block. So for example, say you're scheduled for a shoulder surgery. What we'll do is we'll place numbing medicine around the nerve bundles that give you distribution over your arm. And when we do that, we'll do three things. We'll make your arm heavy and numb. We won't allow it to move. And most importantly, we intercept the pain signals that are coming from your shoulder to your brain during the course of surgery. So that's what it means when your arm is blocked for surgery. First, what we do is we take your proper history, we consider your surgery, we have a conversation with your surgeon, and we just want to make sure that you're a safe candidate for a nerve block. We're going to explain the risks and the benefits and ask for your consent to make sure that you're okay with getting a nerve block for surgery. And assuming all of this is straightforward, we'll then use your IV line to give you a little light sedation for your comfort and basically get our equipment ready to place the nerve block. We'll then clean off the area with sterile solution, and then what we do is we bring in an ultrasound and a special stimulating needle, and we find the precise area, the precise location where we want to deposit the numbing medicine. So occasionally in certain types of surgeries, we'll even place a small catheter so that you can continuously get medicine for several hours and even days after surgery as well. The overwhelming benefit of a nerve block is that it significantly decreases or eliminates the pain that you experience both during and after surgery. And this is actually a really big deal. In our country, we're facing a national opioid epidemic, and it's critical that all of us as physicians, anesthesiologists, around the time of surgery, it's important to minimize the amount of narcotic that we need to use for pain control. a better pain relief with a nerve block, it means that we have to use less IV and less oral pain medicines after surgery. It decreases the overall risk for addiction that's associated with taking narcotic pain medicines. Decreasing the need for narcotics also will help decrease their side effects as well. Things like nausea, vomiting, itching, increased drowsiness and fogginess. It'll also help you potentially decrease the length of your stay in a hospital and get you home faster, back to your own environment, safe environment, back to where you want to live, and get back to your normal everyday life. Complications with nerve blocks they're pretty rare. So certain blocks or series of blocks, they may not be able to eliminate all of your pain. And in these cases, we will need to supplement with IV or oral medications as needed. Some of our patients, they express a fear of permanent numbness or permanent nerve damage. Unfortunately, we're able to reassure them that although there have been cases reported, this type of complication is exceedingly rare. Actually, most prolonged neurological symptoms that we see will eventually resolve over the next few days to weeks. And of course, anytime we introduce needle to skin, there's always a risk for infection and bleeding, but to help prevent this, we do blocks in a controlled and clean environment where we clean your skin and sterilize before we even begin the procedure. The part of your body that gets blocked will be asleep after surgery as well, and it can last anywhere from about 8 to 16, sometimes up to 24 hours after surgery. And again, in certain types of surgery, if we do place a nerve catheter, we can continuously give you medicine, and that numbness then can last as long as the catheter is delivering medicine, sometimes in certain instances up to several days. I'd say before your surgery, ask your anesthesiologist if you're a candidate for regional anesthesia. So you want to have that discussion basically so that you understand all your options. After surgery, I'd say be careful to protect the part of your body that's been blocked, and try not to bump it, bump your arm, your leg, whatever we have blocked is asleep, and you may not be aware of what you're bumping into. So just be cognizant and be aware of your surroundings. So follow your surgeon's directions very closely, wear your arm sling appropriately, walk with assistance if you have to. If you have any questions or concerns relating to the block itself, feel free to contact your anesthesiologist and we'll be happy to answer any questions you have. Thanks for having me. Great topic, regional anesthesia. See you next time.